Emerging Rural Leader, Katie Beyer. In the short time Katie Beyer has worked in public health, she has already made a difference. Katie is the prevention specialist for City County Health District in Valley City. Katie was hired to lead the work for the Partnership for Success grant in 2016, and during that time she has worked closely with local and state colleagues to share materials and assist in developing statewide strategies to decrease underage alcohol use.
She's always upbeat, open door policy, easy to get along with. That's things that's installed in you, and she has that ability.
She has worked closely with the Valley City Police Department to develop and provide scheduled responsible beverage server trainings, educating servers as employees change within local businesses.
Katie's work in her local community with her local leaders. One of those outcomes that she saw with this grant that we administer through the Department of Human Services was the server training law or server training ordinance, where it's a requirement that people who serve alcohol receive training for that, like how to look for fake IDs, how to identify underage drinkers, and then which ultimately reduces underage drinking and ultimately reduces consequences. So it was a huge success for her community to see this policy passed.
She has also worked to create new programming. With a friend and colleague, Katie developed the Not in My House campaign, which is now used in many states across the nation. Not in My House is a collection of grassroots community prevention efforts aimed at reducing youth alcohol access by raising awareness of social host liability.
She is inherently curious and always interested in any public health topic, from septic systems to healthy nutrition to opioid prevention. She's always ready to learn and then digs in to try to work towards solutions.
Katie is a very driven young professional. She's committed to her community and to public health, and I just really couldn't think of anybody else who is more deserving of this award.
Katie is an active member of the Barnes County Behavioral Health Coalition, where she has provided education and continually advocates for public health.
We've had the opportunity to work on a few big projects over the past couple years, and she's a team player. She's very directed and focused on what she needs to do, but she doesn't just take over and assume all the responsibility or kind of push all of her viewpoints or solutions on. She even really allows people within a team to develop their own ideas. She's just a thoughtful person that way, so that you feel comfortable thinking and contributing yourself. She just kind of has all of those qualities you'd want in a leader.
Katie displays wonderful leadership abilities. She is committed to decreasing underage drinking in the county and region. Her interest in public health starts with why are things done a certain way and how can they be improved for everyone in her community.
I just want to take a minute to say thank you to those who nominated me for the Emerging Public Health Leader Award. It means a lot to have your work recognized formally by peers and by people in leadership positions in the community. Their partnership is essential to all of the things that we do in public health, and specifically to the initiatives that I have been involved with. And so I just want to again say thank you to my peers and my colleagues, and to Teresa Will, who has been a wonderful mentor for me and has really opened the door to me getting started in public health and rural health care.